This is me Arju here and I welcome you to my channel Mr. Teeth, where your dental concept get dissected. So this is our part 5 video of the alveolar bone, and in this video we will be discussing the remaining topics of the alveolar bone. Okay, and we have those topic remaining, that is function of the alveolar bone, development of the alveolar process, structure of the alveolar bone and the age changes. Okay, so particularly this video, okay, will be dedicated fully to the alveolar bone. Okay, as this the chapter name. Okay, so the chapter's name is alveolar bone, but in the previous video we have discussed with the general concepts of the bone. Okay, that is applicable in every parts of the body. Okay, but in today's video we will be particularly discussing with the histology of this alveolar bone. Okay, so this video is very important, and this is the last video of the alveolar bone, and after this video we will be starting another chapter of the dental histology. Okay, so now without delaying much, let's start our today's video. So in the first line, as I have written here, okay, so alveolar process is defined as that part of the maxilla and the mandible that forms and supports the socket of the teeth. Okay, so previously also we have discussed in the first video. Okay, so alveolar process, okay, so it is the defined as the part of the maxilla, that is the upper jaw, and the mandible, that is the lower jaw. Okay, so it is in those jaw, okay, in the maxilla or in the mandible, and that supports, okay, that supports the teeth in the socket. Okay, so it supports the sockets of the teeth. Okay, so it forms the socket in which teeth is lodged. Okay, so I think you are clear in this. So in the function we can see in the first point. Okay, so it houses the root of the teeth. Okay, so it houses the root of the teeth, so it forms the socket in which root of the teeth is present. Another point is anchors teeth by the sharpish fiber of the periodontal ligament. Okay, so this alveolar bone, okay, so it is the support of the tooth. Okay, as the periodontal ligament is connecting the cementum of the tooth with the alveolar bone. Okay, so it forms the support of the teeth. Okay, so it anchors the teeth by sharpish fiber of the periodontal ligament. I think you are clear in this. After that, it helps to move the teeth for better occlusion. Okay, it also helps in moving the teeth, okay, for the better occlusion. So during the orthodontic treatment, okay, so we can just change the little bit structures in this alveolar bone. Okay, so it helps to move the teeth for better occlusion. Okay, so when we just apply the orthodontic treatment, okay, so there is bone remodeling. Okay, so with the bone remodeling there is the changes in the structures of the alveolar processes, and that is in such a way that it is going to make the better occlusion. Okay, so it moves the teeth for the better occlusion. After that, it distributes the occlusal forces, blood supply to the periodontal ligament. Okay, so it is the structure from which blood vessel passes. Okay, so Habersen canal we have discussed. Okay, so Habersen canal is there, Habersen system. Okay, Boltzmann canal is there. Okay, so in all those systems there is the blood vessel, and blood vessel is going to pass into the periodontal ligament. Okay, and it is going to supply that, and after that it is going to supply the pulp of the tooth also. Okay, so now in another point, protects the developing permanent teeth bud. Okay, so it also protects the developing permanent teeth. Okay, so it gives the protection. After that, it also assists in the eruption sequences. Okay, so this alveolar process is also very important in the eruption. Okay, so as it is important in eruption process, so it is also significant in this eruption sequence. Okay, so there is a sequence of the eruption. I think you have learned in this dental anatomy about the eruption sequences. Okay, so now we have discussed with the functions of the alveolar bone, and they are mostly asked in a short note. Okay, so once you look this, then you will be more clear in this, and you should not have to learn this for more other times. Okay, so once you look this, okay, and you will get the overview, and you can write in your own way in the exam, and this is also very easy of among all those topic of this chapter. Okay. So now in this development of the alveolar process, okay, so at the end of the second month of the fetal life, okay, so maxilla and the mandible forms the groove that opens towards the oral cavity. Okay, so this is a midline. Okay, and in the above we have maxilla, in the downside we have mandible. Okay, and the maxilla and the mandible, there is the developing of the groove. Okay, so the groove is formed in the maxilla. In maxilla and the mandible are also growing at that time. Okay, so there forms a groove. Okay, so this, like this group. Okay, so this is a coronal section. Okay, so this is a coronal section, and we can see the groove here. Okay, but this is not the coronal section. Okay, I'm just showing this for the schematic purpose. Okay, so this is a groove developing in the maxilla and the mandible, okay, and this is a ultra structure view, okay. So it is a ultra this is a more clear view of that groove, okay. So we can see the tooth germs there, okay. So these are the blood vessel and the nerves, okay. So those are the blood vessel and the nerves, and these big blue dots are the tooth germs, okay, developing in that tooth groove, in the grooves of the maxilla and the mandible, okay. After that, tooth germ develop within the bony structure at the late belly stage, okay. So these are the tooth germ, okay, that I have told you previously also. So now bony septa and the bridges, okay, begin to form and separate the individual tooth germ, okay. Along the tooth germ, alveolar nerves and the vessels are also present, okay. So those are the tooth germs, okay, and between those tooth germ, okay, I'll show you with the another pin. So between those tooth germ, okay, so there's develop a septa, okay. So in between we can see the septa develop, okay. So there is a developing of the bony septa and the bridges, okay, which is separating the one tooth germ from the another tooth germ, okay. And also along with the tooth germ, okay, there is a alveolar nerves and the vessel present there, okay. After that, tooth germ within a compartment shows the bodily movements, okay, and that is causing the bone remodeling, okay. So tooth germ within a compartment shows bodily movement, and that is causing the bone remodeling. After that, at the same time, cells in the dental follicle starts to form periodontal ligament and the cementum, and also the alveolar bone proper, okay. So at the same time, okay, we can see the cells of the dental follicle, okay, cells of the dental follicle starts to form the periodontal ligament there, okay, and the cementum, and also alveolar bone proper is also formed at that time itself. After that, in the last point, alveolar process forms with the development and the eruption of the teeth, and conversely it gradually diminishes with the height after the loss of the teeth, okay. So this is very important line, okay. So in the complete denture, also in the prosthodontics, okay, also you have listen that, okay, if there is if the tooth, okay, is not in the jaw, then the regions of this alveolar process, okay, it will be resorpting, okay. So there will be decreasing in the height of the alveolar process there, okay. So now we will move to our another topic, that is structure of the alveolar bone. So now in this topic, a structure of the alveolar bone, okay, so we will be discussing with the structure of the alveolar bone, okay. So there are two major parts of this alveolar bone. One is alveolar bone proper, another is a supporting alveolar bone, okay. So alveolar bone proper and another is a supporting alveolar bone, and this is the very important topic of this chapter, okay. If they will ask you in the exam from the alveolar bone, then they will ask this topic, okay. So now alveolar bone proper we will be discussing first with this, and after that we will discuss with the supporting alveolar bone, okay. So alveolar bone proper, it is 0.1 to 0.4 mm thick, okay. So thickness of the alveolar bone proper is 0.1 to 0.4 mm thick, okay. After that, it surrounds the root of the teeth, gives the attachment to the principal fibers of the periodontal ligament, okay. So this is the main portion of the alveolar bone, okay, that is surrounding the root of the tooth, okay. So here is a picture, okay. So this is a front view and this is a side view, okay. So from front, okay, we can see the structure, okay. This is a socket like structure in which the tooth is present, okay. So here is the periodontal ligament, okay, which is connecting the tooth with the alveolar bone, okay. So now this portion of the tooth, okay, so this line and this line here, okay, so they are that portion of the alveolar bone, okay, which is assisting, which is helping in the attachment of the tooth into the socket, okay. So they just surround the teeth and gives the attachment to the principal fibers of the periodontal ligament. After that, it consists the two other parts, okay, in itself too. So we have laminated bone, another is a bundle bone, okay. So laminated bone, it contains the osteon, each of which contain the blood vessel in the Haversian canal, and lamellae are present parallel to the marrow surfaces, okay. So this one is the laminated bone, okay. So this laminated bone structure is bit similar with that of the compact bone, okay, that we have discussed earlierly. So it contains the osteon, and in that osteon it contains the blood vessels, okay, in the Haversian canal, okay, and lamellae, okay. So lamellated bone means there is a presence of the lamellae, and the lamellae are present parallel to the marrow spaces, okay. So that is the laminated bone. So in this portion we can also see the laminated bone at some places, okay. And also other type of bone, that is bundle bone, is also present in this alveolar bone proper portion of the alveolar process. Okay, so that is the bundle bone. So bone in which the principal fiber of the periodontal ligament are anchored. Okay, so those are the actual alveolar bone proper which is assisting in the attachment of the periodontal ligament. Okay, so bone in which the principal fibers of the period is anchored. After that, it is termed bundle because, okay, it was chosen because bundles of the principal fibers are inserted into the bundle bone. Okay, so this is very easy to understand. Okay, so they are called bundle because the principal fibers in the bundles are attached there. After that, scarcity of the fibrils in the intercellular substances, and they are arranged parallel to the surface fiber. Okay, so the fibrils, okay, are scarce there. They are less in number in the intercellular substances in the bundle bone, and they are also perpendicular to the surface fiber. Okay, so this is a surface fiber, and the fiber at this portion, okay, they are quite straight. Okay, and they are perpendicular to the, so they are like this. Okay, so these are the fibrils in the bundle bone, and this is the surface fiber, so they are at the 90-degree. Okay, so after that, it appears dark in HNE stain. Okay, so it appears dark in HNE stain, and it is formed in the area of the recent bone apposition, and lines of rest are also seen in the bundle bone. Okay, so these are formed in the recent bone apposition area. Okay, so area of the recent bone apposition means just mineralization is taking place there. Okay, so we can see the lines of rest there. After that, radiographically it is called lamina dura. Okay, so radiographically the name is lamina dura there. Okay, after that, alveolar bone proper on the inner wall is perforated by many openings that carry branches of the interalveolar nerves and the blood vessel, and therefore called the cribriform plate. Okay, so this alveolar bone proper. Okay, so there we can see the, there we have laminated bone, also we have bundle bone. Okay, and in those bundle, okay, so we can see the perforations. Okay, so perforation is present there. Okay, and the perforation is by the surface fiber also. Okay, and also by the interalveolar nerves and the blood vessel. Okay, so they are called cribriform plate. Okay, so therefore also it is called cribriform plate. Okay, so alveolar bone proper on the inner wall is perforated by many openings that carry the branches of interalveolar nerves and the blood vessel, and therefore called cribriform plate. Okay, so cribriform means perforations. Okay, so cribriform means there are perforations in it. Okay, so this is a cribriform plate. Okay, after that, bone between the teeth. Okay, so bone between the teeth. Okay, so if this is one teeth and if there is another teeth, okay, so just think this is another teeth. Okay, so if this is another teeth, okay, so this structure which is between the two teeth, okay, so it is the interdental septum or interradicular septum. Okay, and it contains the perforating canals of the Zucker candle. Okay, perforating canals of the Zucker candle and the Hirschfeld, which houses the interdental and interradicular arteries, vein, limb vessel, and the nerves. And this is very important. Okay, so I'll draw here. Okay, so this is surface fiber. Okay, and sometimes this surface fiber also, okay, cross the, okay, so it just perforate the interdental septum and again comes out in the periodontal space of another teeth and again attached to the cementum of another bone. Then this is called transseptal fiber that we have discussed in a periodontal ligament video. And also, as we have told, okay, here, that in the inner walls of the alveolar bone there are many perforations, and the cause of the perforations in the nerves and the blood vessel. Okay, so sometimes the nerves, okay, it may run from the periodontal space of one teeth to the periodontal space of the another teeth. Okay, so it forms the canal in between. Okay, so there is a canal. Okay, so this is the canal here. Okay, so this is a canal here. So in those canal we can see the running of the interdental interradicular arteries there. Okay, and that canal is called canal of a Zucker candle or Hirschfeld. Okay, so this is a very important question for your MCQ exam, also for your YY exams. Okay, so that canal is called canal of Zucker candle. Okay, after this we will learn about the supporting bone, and supporting bone also it have the two parts. Okay, one is cortical plate, another is spongy bone. Okay, so I'll show here what is the supporting bone. So as in the previous, in this alveolar bone proper, okay, so as I have told here, okay, so this is a alveolar bone proper. Okay, and those dotted structure, okay, so which is forming the interdental septum. Okay, so those dotted structure are the trabecular bone. Okay, and they are the supporting bone. Okay, so this is a supporting bone. So this is a side view and this is a supporting bone. Okay, so this is a supporting bone here. Okay, so it is a bone that is supporting the alveolar bone proper to anchor the periodontal ligament fiber. So it is in the easy language. Okay, so this is a supporting alveolar bone which is supporting the alveolar bone proper to anchor the periodontal ligament more strongly. So this is a supporting bone here. Okay, after that, okay, so we have cortical plates and the spongy bone. Okay, so cortical plate means it consists of the compact bone and forms the outer and inner plates of the alveolar process. Okay, so this is, as this is a side view. Okay, so in this picture it is the side view of the tooth. Okay, so this surface, okay, so this surface, this is a labial. Just think this is a labial, this is a lingual. Okay, so this is labial and this is lingual. Okay, so this LA and this is LI. Okay, so lingual, LI lingual. Okay, so in this place, okay, we can see the compact bone which is surrounding this supporting bone along with this alveolar bone proper. Okay, so by the outer environment. So this is the compact bone. Okay, and this is called the cortical bone. So it consists of the compact bone and forms the outer and inner plates of the alveolar bone process. Okay, so that is the cortical plate. After that, it continues with the compact bone of the maxilla and the mandible. Okay, it will be continuous. Okay, and it is thinner in the maxilla than the mandible. Okay, so it is thinner in the maxilla. Okay, so those points you should learn. Okay, you should remember it. Okay, it is very important. After that, it is thickest in the premolar and the molar region of the lower jaw, especially on the buccal side. Okay, so this is also very important question for your MCQ exam. Okay, so it is thickest in the premolar and the molar region of the mandible. Okay, of the lower jaw, and also it is in the buccal side. Okay, in the region of the anterior teeth of the both the jaw, supporting bone is usually thin. Okay, so in the region of the anterior teeth, supporting bone is usually thin there. After that, outer buccal plate of the maxillary premolar and the molar have a defect. Okay, so this is also very important, you should learn. So outer buccal plate, okay, outer labial plate of the maxillary premolars and the molars have the defect. Okay, so the defect is periodontal tissue fuses with the mucosal covering. Okay, so periodontal tissue, okay, they fuse with the mucosal covering there, called dehiscence. Okay, and in spite of this, okay, it doesn't impair the form, attachment and the function of the tooth. Okay, so it is called, the defect is dehiscence. Okay, so at the outer buccal plate of the maxillary premolars and the molars we have the defect. Okay, and the defect is periodontal. Okay, periodontal tissue, it just fuses with the mucosal covering. Okay, and it give the defect there. Okay, it appears like a defect there and it is called dehiscence. But in spite it is the defect, okay, but it doesn't impair in the form, attachment and the function of the tooth. After that, it contains the longitudinal lamellae and the Haversian system. Okay, so in compact bone we can see them. Okay, so that is the general thing. So in the cortical plate, just you should have to think is that it is the outer and inner plate of the alveolar process. Okay, that is consisting of the compact bone, and it is continuous with the compact bone of the maxilla and the mandible. It is thinner in the maxilla than the mandible, in the premolar and the molar region of the lower jaw, and in the buccal side is thickest, and also in the outer buccal plate of the maxillary premolars and the molars have the defect, and the defect is dehiscence. There is a periodontal tissue fusing with the mucosal covering. Okay, so in spite this is a defect, it doesn't impair in its function. Okay, in its form, attachment and the function. Okay, so that is the thing you should learn in this cortical plate. After that, in the spongy bone, okay, so it fills area between the cortical plate. Okay, so this maximum bulk of the supporting bone is formed by this spongy bone. Okay, so those dotted structures that I am showing here, okay, so they are the trabeculae bone or the spongy bone. Okay, so it fills the area between the cortical plate and the alveolar bone proper. Okay, after that, it surrounds by the marrow. It is surrounded by the marrow, which is rich in the adipocyte and pluripotent mesenchymal cell. Okay, so it is surrounded by the marrow. Okay, so marrow species are there, and we can see the adipocyte there, pluripotent mesenchymal cell is present there. Cancellous component is more in the maxilla than the mandible. Okay, so this is MCQ question. So spongy bone portion is more in the maxilla than that of the mandible. Similarly, in the spongy bone also we have type 1 and type 2. In type 1 it is seen in the mandibular teeth, okay, so in the lower jaw, and the trabeculae are arranged in a ladder like fashion in the mandibular teeth in the lower jaw, but in the type 2 it is seen in the maxillary teeth and trabeculae are irregularly arranged there, okay. So we have type 1 and the type 2. Type 1 is in the mandibular teeth, type 2 in the maxillary teeth. Type 1, there the trabeculae are arranged in a proper orientation, they are arranged in ladder like fashion, but in the type 2 it is irregularly arranged there, okay. After that, our next topic, okay, another next topic, it is not another topic but it is some small topic inside this structure of the alveolar bone, okay. So there is a crest of alveolar septa, okay. So crest of the alveolar septa means this, okay. So this is a crest of the alveolar septa, okay. So tip of the alveolar bone, okay. So also in the interdental, okay, so also from the front view we can see the crest there, okay. So also from the side we can see the crest there, okay. So it is a crest of the alveolar septa. So cortical bone and the alveolar bone proper, okay, alveolar bone proper, okay. So it is meeting at the alveolar crest, usually 1.5 to 2 mm below the cemento-enamel junction, okay. So you should learn this. After that, shape of the outline of the crest of the alveolar septa dependent upon the position of the adjacent teeth, okay. So shape of the outline of the crest of the alveolar septa, okay. So it is dependent upon the position of the adjacent teeth. So it is mostly dependent on the position of the alveolar adjacent teeth, okay. So adjacent teeth position determines the shape and outline of the crest of the alveolar septa. After that, with the neighboring teeth it is inclined, okay. With the neighboring teeth, okay, inclined, the alveolar crest is, okay. So if the neighboring teeth, okay, it is inclined, then alveolar crest is oblique. In the most of the individual, inclination is more pronounced in premolars and the molars region, okay. So in the neighboring teeth, okay, so as I have written in the second point, okay, so adjacent teeth determines the shape and the outline of the crest of the alveolar septa. So in the neighboring teeth, okay, if it is inclined, then alveolar crest will be more oblique, okay. So it should be straight like this, but it is not straight, okay, but it becomes quite of like this, okay. So it is oblique there, okay. So it forms the shape, it forms the outline of oblique, okay, and it is more inclined, okay. So the teeth is more inclined, more pronounced in the premolar and the molar region, okay. So now our another subtopic is the internal reconstruction of the alveolar bone. And in the internal reconstruction of the alveolar bone, okay, so it is quite related with that of the bone remodeling, okay. So formation, resorption is taking place simultaneously inside the alveolar bone, okay. So there is an internal reconstruction itself in the alveolar bone, okay. So mesial drift and the continuous tooth eruption elicit remodeling of the alveolar bone proper, okay. So mesial drift means the tooth is drifting towards the mesial side, okay. The root of the tooth, okay, so tooth itself, okay, so it is drifting toward the mesial side, okay, toward the center of the jaw. So mesial drift and continuous tooth eruption, okay, continuous tooth eruption elicit, okay, eruption elicit the remodeling of the alveolar bone proper. And during the mesial drift of the tooth, okay, bone on the mesial alveolar wall shows signs of the active resorption, okay, and apposition on the distal wall, okay. So I have written here. So okay, so in this picture, okay, so here in this picture just you should think, okay, so I'll draw a schematic diagram here, okay. So 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 if this is a lateral incisor, just you think, okay, and this is a, okay, so this is alveolar bone here, okay, and if this is drifting towards this side, okay, so this is a mesial wall here, okay. So this is mesial wall here and this is distal side here, okay. So in this wall, okay, so if in this wall, okay, I'll draw with another pen. So in this wall we can see the mineralization here, okay. We can see, sorry, resorption we can see here, okay. So during the mesial drift of the tooth, okay, bone on the mesial alveolar wall shows signs of the active resorption, okay. So in the mesial side we see the resorption and in the distal side there is a deposition, okay. So in this side we can see the deposition, okay. So as it is drifting toward the mesial side, okay, so we need the space here, so there is a resorption but we need to fill out here, okay. So this space should be filled, so there is a deposition here, okay. And after that, periods of resorption alternate with the periods of rest and repair, okay. So this is a common point here, okay. So periods of resorption alternating with the period of rest and repair there. And after that, during eruptive phase, deposition at the base of the socket. Okay, so similarly if this is going to erupt, okay, so at this portion, okay, so if this is a base of the socket, so there should be deposition, okay, so that it would be erupting. Okay, so that is the general concept and common sense. So at this base of the socket there is a deposition and it is going to erupt, okay, in the upward direction. Okay, so during the eruptive phase, deposition at the base of the socket, bundle bone present shows numerous resting line. Okay, so about this resting line, reversal line, we have discussed properly. Okay, so when the mineralization is happening, okay, so we can see the rhythmic lines. Okay, so that is the resting lines. Okay, but reversal line, it is separating the bone resorption from the bone formation, bone mineralization. Okay, so that was the reversal line. So internal reconstruction of the bone, just you should have to think it is happening in the two ways, one in the mesial rift, another in the bone eruption. Okay, so in the mesial rift, the mesial wall is going to be resorbed and the distal wall is going to be deposited, and in the eruption, in the eruptive phase, okay, so the base of the socket, okay, so there would be deposition. Okay, so that is the thing you should learn here. After that, in the age changes, so gradual decrease in the bone formation with a resultant significant decrease in the bone mass. Okay, so that is in the age changes. Okay, so there is a gradual decrease in the bone formation with the age and the resultant significant decrease in the bone mass. After that, osteoblast proliferating precursor cells are also decreased there, and after that there is decrease in the width of the cribriform plate and the interdental alveolar septum. Okay, and that is mostly in the rats and the monkey. Okay, so width of the cribriform plate, okay, so cribriform plate was in the alveolar bone proper, so the width is decreased there, and the interdental alveolar septum width is also decreased, and this is mostly in the rats and the monkey but not in a human. And the fatty marrow in the human. Okay, after that, increase the distance between the alveolar crest and the cemento-enamel junction. Okay, so normally it is 1.5 to 2 mm. Okay, but it is increased. After that, there is increase in a number of interstitial lamellae. Okay, okay, so with the age changes we have completed this chapter, alveolar bone. Okay, and I think I have tried to clear all your concept in this alveolar bone. Okay, and I have discussed all those general topics too, okay, in more detail, that is present in the Orbans. Okay, so our reference book is the Orbans. Okay, I used to prepare all those notes from the Orbans. You guys know it well. Okay, so that I hope I am successful in explaining all those topics, all those subtopics in this chapter, and you will do better in the exam by learning all those points. Okay, and you can rely on those notes. Okay, and for the notes, it is present in the Telegram channel. So now we will meet in the next video, next chapter of the dental histology, and that is salivary gland. Okay, so till then, stay happy, stay healthy, study well. Okay, so tata, bye bye, thank you.